Hi, this is Dr. Ana Lara. I'm Medical Director at Trinity Stem Cell Treatment and Rejuvenation Center. Today, we will be speaking about stem cell therapy in autism spectrum disorder. So first of all, what is autism spectrum disorder? It is a complex behaviorally defined disorder, and it includes several conditions, which are autism disorder, pervasive developmental disorder not otherwise specified, and Asperger's syndrome. So for me to give you some historic context on these were diagnosed separately before until 2013. This is when the American Psychiatric Association released a fifth edition to the Diagnostic and Statistical Manual of Mental Disorders, known as DSM-5. And what they did is they grouped these conditions together into one spectrum. So ASDs are well-defined inflammatory conditions, and they also have an immune system dysfunction. This is very important when it comes to how stem cells can help, and we will be discussing this later. Autism spectrum disorder are characterized by two core domains. So these core domains are very important when it comes to diagnose. Um, the first core domain is persistent deficit in social communication and interaction. Some examples of how these might look like would be failure of normal back and forth conversations, just having a normal social approach, or it might be difficult to involve in eye contact and body language. Also, some deficits in understanding and using gestures, or just have a total lack of facial expressions and nonverbal communication. And then the second core domain is restricted or repetitive patterns of behavior, interest, or activities. These might look like, for example, lining up toys, flipping objects, echolalia, or just having difficulties with transitions, finding extreme distress at small changes. Some of these children need to take some route, the same route every day, or just eat the same food every day. They might find some strong attachment to or preoccupation with unusual objects. ASDs are progressive disorders of brain development spanning nearly all of pre and postnatal life. And we spoke about all of these core domains and how they might look like, but usually the biggest problems in autism are triggered by associated symptoms, which might be irritability, anxiety, aggression, compulsions, mood lability, gastrointestinal issues, or sleep disorders. And all of these are very common and very frequent to find in autism spectrum disorder diagnosed children. So when it comes to putting ASD into numbers, we need to know that ASD affects more than 1% of the general population. This means that for every 59 children, one is diagnosed under autism spectrum disorder. Some articles mention one for every 54, one for every 52. It is 4 times more common in boys and girls. And we need to know that ASD has no preference for socioeconomic groups or racial or ethnic groups. So how is it diagnosed? Well, it's not always easy. There are no lab exams whatsoever. It usually takes a multidisciplinary approach, and it involves a pediatrician, which is a doctor who usually has first contact with the patient, and then a group of specialists that might include a child speech pathologist, a neurologist, or an occupational therapist. Autism is diagnosed through observation and psychometric test, but the clinical diagnosis is made based on the presence or absence of core behaviors, which we just spoke about earlier. Also, the DSM-5 is very important. It is conventionally used as a gold standard for autism diagnosis. When it comes to treatment, we need to know that there is no cure up to this date for autism spectrum disorder, but there are different treatment options to consider. So treatment comes in variable and multimodal. There is no one-size-fits-all treatment. We saw lots of examples of these core domains and symptoms. So it needs to be tailor-made, and it's directed towards symptoms and core domains. So it is composed of conventional therapies. These conventional therapies might include speech therapy, occupational therapy, or just early intensive behavior therapy. Also some medication. Medication might include antidepressants, not because of depression itself, but these medications usually have lots of uses. And then antipsychotics or anticonvulsants. Some children diagnosed under the spectrum have seizures. And then some medication for anti-anxiety. There are also alternative treatments. These might include hyperbaric oxygen treatment or music therapy. Also, cognitive and social behavioral therapy might help a lot. And then all the nutrition approach when it is associated with gastrointestinal issues. There are some articles that mention hormonal therapies with oxytocin and the use of vitamins, herbals, essential oils, supplements. These might have some effect in symptomatic improvements, but as everything, there need to be some additional studies to confirm these benefits. So now we're stepping into stem cell world, and we are discussing some advances in stem cell treatment for autism spectrum disorder. So I want to be clear and state right off the bat that stem cell therapy is not considered a cure for ASD. So we are by any means guaranteeing or offering any cure for ASD. But then again, we just mentioned earlier, there is up to this date no treatment that can be considered a cure for ASD. So even though stem cell therapy might not cure up to this date ASD, it is showing remarkable and huge improvements in quality of life to the children, and not only to them, because their family members are improving their quality of life as well. So how do stem cells work? They do have some mechanisms of action. Once they enter the body, they start migrating to all these areas of lesion or inflammation, and this is called homing. And then they start working to reduce inflammation and modulating immune system. And why is this important when it comes to ASD? Well, ASDs have shown that there are some immune system abnormalities, and there is a strong pro-inflammatory cytokine production. So there is an imbalance in the immune system. There are productions of what we call it an interleukin 1, which is a pro-inflammatory interleukin, and we just don't want that. So stem cells are going to start working. They do have an immune modulatory capacity that could restore these ASD immune alterations. So stem cells start working to inhibit all these cell overactivation and proliferation. And what they do is they increase the anti-inflammatory interleukin 10 levels. And that's the way how they start reducing inflammation. And then other mechanisms of action for stem cells are angiogenesis. And this is basically a new formation of blood vessels that might increase oxygen levels to some areas of hypoxia. And then they also have a paracrine effect, which is communication to other stem cells in order for them to migrate to areas where they are working into the same regenerative purpose. So what type of stem cells are we using, and why are we using them? This is some evidence on Wharton's jelly umbilical cord mesenchymal stem cells, which are the stem cells we are using, and why are they making a promising treatment option for ASD. These MSCs are relatively easy to isolate and expand in culture, and they are also capable of self-renewal and differentiation. Also, these MSCs can be transplanted directly without genetic modification or pretreatment, which means that unlike bone marrow transplant, we do not need to do ABO cross-matching, and we do not need to do any HLA matching, because stem cells, mesenchymal stem cells, are not a product of blood, and they also lack the expression of HLA markers. So it's not necessary because we do not see any rejection of these cells. Also, and it's very important to us, there are no ethical issues involved whatsoever, and there is also no risk of teratoma formation or tumor growth. So it's very safe, a very safe therapy for ASD. Some points to consider when you're looking for treatment options. Here at Trinity Stem Cell Clinics, we have fluent English and Spanish speaking staff members. We are going to help you make your travel arrangements and arrange daily transportation between your hotel or residence and our clinic. And the next point is very important. We treat our patients like family at all times, so we are going to follow up regularly to keep you on track to recovery. And we promise to provide you always with a white glove service at every step of your experience. And from the quality perspective, some points to consider. All our mesenchymal stem cells are ethically sourced, and this is very extremely important to us. It's part of the Trinity difference we are promising you. They are the highest quality Wharton's jelly umbilical cord mesenchymal stem cells. They have a viability of above 95%. These are natural live cells. They are not frozen. So we are not doing any thawing. No viability of the cells is being affected. These cells do not need to do any cross-matching, as we mentioned earlier. The expansion process is being made no more than 5 times to ensure your quality. And our lab is certified and licensed for your safety and protection. When we talk about Trinity difference, we are talking about one word, and we are promising you with transparency. Our cells come with a lab certification for you to have. where you can see your cell count, your cell viability, the medical history of the donors. They are ensuring that it's ethically sourced, and also your cells can be viewed on a microscope connected to a TV in order for you to see that your cells are actually live and moving. This is something we want to always provide our patients for your peace of mind and also to ensure that our quality standards are the highest. So what are you waiting for? Contact us for more information and visit our website www.trinitystemcells.com or send us an email to info@trinitystemcells.com. You can also call our US phone line 956-267-1586 or our Mexican phone line 867-980-0548. We are looking forward to hearing from you soon.